Hello. Have you ever wondered if your sleep could actually kill you? Do you sometimes wake up the next morning feeling tired, even though you had a full night's sleep? Did you know that small habits you might not notice at night could be putting you at risk, especially if you're over 70? Imagine this. You're lying in bed, your body resting, but there are hidden dangers that you don't even know about. You may wake up the next morning and not have the chance to do the things you love, all because of some overlooked habits. This could make you think sleep is just rest. But the truth is, sleep can be the most dangerous time of day if you don't pay attention to the small changes in your body. These habits are not severe medical conditions or rare diseases that you only hear about in doctors' conversations. They are harmless habits that we often overlook, and if not recognized early, they can lead to unforeseen risks. Let's explore 4 silent signals you may not have noticed and how you can protect your health effectively during sleep. There's a health issue that is often overlooked but can lead to serious consequences for older adults, especially after the age of 70. High blood pressure at night. Most of us know that high blood pressure can lead to serious cardiovascular problems like stroke or heart attack. However, few people realize that blood pressure needs to be monitored not just during the day, but also at night, a time when the body is supposed to be resting. Blood pressure is the force exerted by blood as it flows through your blood vessels. Normally, blood pressure tends to decrease at night when the body rests, allowing the heart and blood vessels to recover after a long day of activity. However, for many older adults, blood pressure doesn't drop at night. It actually increases, forcing the heart to work too hard. This is particularly dangerous because when blood pressure is high at night, you won't feel any symptoms like pain or dizziness, and you only discover the issue when the condition becomes severe. Therefore, monitoring blood pressure is not only important during the day, but also essential at night. Doctors often recommend that older adults use a 24-hour blood pressure monitoring device to check their blood pressure at night. It's a relatively simple method, but it can uncover hidden issues that you might not detect through regular feelings. Patricia's story, the importance of checking blood pressure at night. Imagine the story of Patricia, an 81-year-old woman who always paid attention to her health and regularly checked her blood pressure during the day. Every day, she visited her doctor to check her blood pressure and was proud of maintaining stable levels. However, during a routine health checkup, her doctor recommended a 24-hour blood pressure test to check her nighttime blood pressure as well. This simple test revealed a surprising fact. Patricia's blood pressure didn't drop at night, but actually spiked around 3 a.m., when her body was supposed to be in its deepest rest. The result led her doctor to adjust her medication timing, helping her blood pressure drop at night and preventing any serious health problems. If this hadn't been detected in time, the increased nighttime blood pressure could have led to a stroke or dangerous heart events while she was sleeping. This small change in her medication schedule likely helped Patricia avoid unnecessary risks and protect her health in the coming years. Why nighttime blood pressure is important. To understand why nighttime blood pressure matters, we need to look at how the body functions during sleep. When you sleep, your autonomic nervous system, the part that regulates involuntary body functions like heart rate and blood pressure, becomes less active, allowing the body to relax. At the same time, your blood pressure drops to allow your heart and blood vessels to rest and recover. However, in some older adults, the autonomic nervous system may not function normally, causing blood pressure to remain high, or even rise while the body is at rest. This can prevent blood vessels from recovering properly, putting strain on the heart and increasing the risk of stroke and heart disease. Meanwhile, prolonged high blood pressure increases the risk of other serious conditions like kidney disease and eye issues. How to control nighttime blood pressure. If you feel tired in the morning despite having slept well, or if you find yourself waking up suddenly in the middle of the night, it could be a sign that your blood pressure isn't stable during the night. Checking your blood pressure at night is a crucial step in detecting these abnormalities and implementing timely treatment. In addition to regular blood pressure checks, here are some lifestyle changes that can help you better control your nighttime blood pressure. Take a light walk in the evening. A short walk after dinner can help relax your body and regulate your blood pressure. Limit salt in dinner. Salt can raise blood pressure, So try to limit its use in your evening meals, especially before bedtime. Reduce stress. Deep breathing exercises or relaxation techniques before sleep can help you reduce stress and stabilize your blood pressure. Control weight. Maintaining a healthy weight is also important in regulating blood pressure. These changes will not only help lower your nighttime blood pressure, but also improve the quality of your sleep and overall health. Sleep apnea, also known as temporary breathing cessation during sleep, is one of the health issues that many older adults may not realize until it becomes serious. In fact, sleep apnea not only causes disrupted sleep, but also directly affects cardiovascular health, reduces oxygen in the body, and increases the risk of death. The concerning thing is that many people don't realize they have sleep apnea. They simply think that the tiredness upon waking up is just a part of getting older. However, the truth is that sleep apnea can have serious consequences. When the body stops breathing for a few seconds or even minutes during sleep, your brain and heart don't get enough oxygen, causing them to work harder. This can lead to serious health issues such as heart disease, high blood pressure, stroke, and even death during sleep. If not diagnosed and treated in time, sleep apnea can be a hidden danger that you cannot ignore. Albert's story, how sleep apnea affects health. You may be surprised to learn that Albert, a 76-year-old man, had lived a healthy life for many years. However, one day, his wife noticed that he stopped breathing for a few seconds while he was sleeping. At first, he didn't think much of it and assumed it was just a normal part of aging. However, his wife became concerned and convinced him to get checked. After undergoing a sleep study, Albert was diagnosed with moderate sleep apnea. The doctor advised him to use a CPAP machine to help keep his airways open while he slept. At first, Albert found it uncomfortable to use the CPAP machine, but after a few weeks, he noticed a significant difference. He woke up feeling refreshed, energized, and no longer felt tired, even though he had slept for the right amount of time. The best part was that his sleep apnea was significantly reduced, helping him avoid heart problems and serious health issues. Albert's story is a perfect example of how sleep apnea can seriously affect health. If left untreated, this condition can cause irreversible damage to the body, especially in older adults. How to recognize and treat sleep apnea. If you frequently wake up feeling tired, with a dry mouth or headache, it could be a sign that you have sleep apnea. However, if you sleep alone, you might not notice these signs because they occur throughout the night when you can't observe them. But don't worry. There are ways to recognize and treat sleep apnea. One of the clearest signs of sleep apnea is temporary breathing cessation during sleep. This usually happens for a few seconds or even minutes. A person with sleep apnea may stop breathing several times during the night without realizing it. If you wake up frequently at night and feel a wheezing sound or experience a sensation of breathlessness, you may have sleep apnea. Doctors may ask you to participate in a sleep study, where they monitor your breathing patterns throughout the night. Based on this, the doctor will provide an accurate diagnosis and recommend appropriate treatment methods. A CPAP machine, continuous positive airway pressure, is a common method used to treat sleep apnea. This machine helps maintain air pressure in your airways, ensuring that you always have enough oxygen while you sleep, thus minimizing the occurrence of breathing cessation and improving the quality of your sleep. In addition to using a CPAP machine, several lifestyle changes can help reduce sleep apnea. These changes include weight loss. Excess weight, especially around the neck and throat area, can put pressure on the airways and cause sleep apnea. Losing weight can help reduce this condition. Avoid alcohol and sedatives. These substances can relax the throat muscles and increase the risk of sleep apnea. Sleep on your side. Sleeping on your side instead of your back can help reduce the risk of sleep apnea, as when you sleep on your back, the tongue and soft palate can obstruct the airway. Adjust sleep habits. Try to maintain a regular sleep routine and ensure that you get enough sleep to improve sleep quality and minimize respiratory issues. Why is sleep apnea dangerous? Sleep apnea not only causes discomfort, but can also significantly reduce the amount of oxygen provided to your body. When the brain and heart do not get enough oxygen, these organs have to work harder, increasing the risk of cardiovascular diseases, high blood pressure, and stroke. Additionally, prolonged sleep apnea can affect mental health, leading to issues like anxiety, depression, and memory loss. However, the good news is that sleep apnea can be effectively treated if detected early and timely intervention is applied. With modern treatments like CPAP machines, patients can maintain good sleep and protect their health in the long run. Air quality in the bedroom, a silent threat. You might think that air quality is only important when you're outside, exercising, or driving in a busy, polluted city. But did you know that the air in your bedroom can have a profound impact on your health, especially when you're over 60? The air you breathe while sleeping not only affects your sleep, but also directly impacts your heart, lungs, and immune system. As we age, our respiratory system becomes more sensitive, and our ability to eliminate pollutants from the body decreases. When your bedroom doesn't have enough airflow, pollutants like dust, mold, or even CO2 can build up in the air, causing negative effects on your health. These pollutants not only cause difficulty breathing, but they can also harm your cardiovascular system, increasing the risk of stroke and heart failure. For people with cardiovascular or respiratory conditions, the air quality in the bedroom can be a crucial factor in their health. Imagine sleeping in a room with poor air quality, with inadequate ventilation, while your body is trying to recover after a long day. It's like trying to run a race while having your mouth and nose covered. Without enough air, you won't be able to perform at your best, and your health will suffer. Walter's story, a small change that made a big impact. Let's look at the story of Walter, 76. Walter had always been healthy, but in recent months, he started feeling tired and confused every morning. He thought it was just part of getting older, but his daughter, who was very health conscious, decided to check the air quality in his bedroom. When she brought an air quality monitor into Walter's room, the result was surprising. The CO2 levels in his room were double the safe range. The accumulation of carbon dioxide in Walter's bedroom was causing serious health issues, particularly affecting his respiratory and cardiovascular systems. When there wasn't enough ventilation, Walter's body couldn't get the oxygen it needed to recover during the night, leaving him feeling tired and lifeless when he woke up. After Walter used an air purifier and adjusted his bedroom habits, like opening the window to increase airflow, the quality of his sleep improved significantly. He felt more alert in the mornings and no longer had the feeling of confusion or tiredness. This proves that even a small change in your sleeping environment can have a big impact on your overall health. We all know that sleep is not just a time for rest, but also a time for the body to recover, rejuvenate, and regenerate energy. However, one important factor that few people pay attention to is movement during sleep. The changes in posture, the small movements throughout the night, are actually very important for your health. When you don't move during sleep, it could be a sign of a serious health issue, especially for older adults. When we're younger, the body can adjust and recover on its own without our intervention. However, as we age, the systems in our body, including the nervous and muscular systems, no longer function as they did before. The body's self-protection system becomes less responsive, and this can lead to insufficient movement during sleep, resulting in serious problems such as reduced blood circulation, increased pressure on organs, and muscle damage. George's story, how lack of movement at night can be a sign of health risk. Let's hear the story of George, an 84-year-old man. Although he's relatively healthy and always had the habit of walking every morning, his daughter began to notice something strange. Every morning when George woke up, his bed always looked like it had not been disturbed. The blanket was still in place. The pillow hadn't moved, and George's body remained in the same position while sleeping. At first, George's daughter thought he was just a deep sleeper, but after paying closer attention, she noticed a concerning issue. He showed no signs of movement throughout the night. His daughter decided to take him for a health checkup. The result was that the doctor found George had a cardiovascular issue. He had reduced responsiveness in adjusting his blood pressure during sleep, a condition that could lead to stroke or other dangerous heart events. Doctors also mentioned that the lack of movement during sleep could be a sign of weakening autonomic nervous function, where the body is no longer responding appropriately to environmental changes. This could lead to heart failure, stroke, or other diseases. Since being diagnosed and starting light exercises like walking, stretching, and deep breathing before bed, George has noticed significant improvements. He started sleeping more deeply, feeling lighter and more energized when waking up. These changes not only helped him have a better sleep, but also protected his cardiovascular health, and improved his overall health. Lack of movement at night. Why is it dangerous? When we sleep, the body needs to adjust its position regularly to relieve pressure on organs, especially the heart and lungs. These movements help maintain good blood circulation and prevent the body from becoming stiff. However, when we become less active during sleep, the body cannot recover properly, leading to several problems such as reduced blood circulation. When the body doesn't change positions during sleep, blood doesn't circulate evenly throughout the body, especially to the limbs and important organs like the heart and lungs. Pressure on organs. When you sleep in a fixed position for too long, your organs are under pressure, which can lead to tension or long-term damage. Muscle stiffness and pain. When the body doesn't change position, it can lead to joint and muscle pain, increasing the risk of back pain, neck pain, and other musculoskeletal issues. Risk of heart failure and stroke. One of the biggest risks is the likelihood of heart disease and stroke. When the body isn't moving enough during sleep, blood pressure and circulation problems can increase, leading to serious cardiovascular events. Especially for older adults, the body's sensitivity to signals has decreased, so lack of movement during sleep can be a sign of nervous system weakness or cardiovascular issues. How to encourage the body to move during sleep. Fortunately, you don't have to do anything complicated to encourage movement during sleep. Here are some tips to help improve your movement while you sleep. Gentle exercise before bed. A few light stretching exercises before bed can help your body relax and establish a habit of movement. These exercises can be as simple as stretching, gently rotating the body, or doing basic yoga poses. Avoid sedatives. If you use sedatives to sleep, discuss with your doctor about reducing the dosage or replacing them with natural methods like relaxation exercises or breathing techniques. Sleep in a comfortable position. Make sure your bed is comfortable and doesn't create pressure on your body's organs. You might try changing your sleeping position, such as sleeping on your side rather than your back, to reduce pressure on the lungs and heart. Keep the bedroom well ventilated. A well-ventilated bedroom with fresh air can help your body adjust better and automatically change positions during sleep. Why is movement during sleep so important? Movement during sleep not only helps you sleep well, but also aids in the recovery of the body, reduces stress, and maintains long-term health. If you don't move enough while sleeping, your body can't recover properly, increasing the risk of developing serious health issues. This becomes even more important as we age, as the body no longer has the ability to protect itself as it did before. Therefore, encouraging movement during sleep is one of the key factors in maintaining health and longevity. Sleep has always been an essential part of our daily lives, especially as we age. However, not all of us realize that sleep is not just a time for rest, but also a time when potential health issues can quietly emerge. Small habits that seem harmless, such as high blood pressure at night, sleep apnea, poor bedroom air quality, or lack of movement during sleep, may be silently threatening your health without you even realizing it. However, the good news is that all of these issues can be prevented and improved if you pay attention to them starting now. Just like Patricia, Albert, and Walter, individuals who recognize the importance of checking their blood pressure, monitoring their breathing during sleep, improving the air quality in their bedrooms, and paying attention to their body's movement throughout the night. Simple changes in daily habits can help protect your health, improve sleep quality, and minimize serious health risks. Don't let these small signs go unnoticed. If you feel fatigued even after a full night's sleep or notice abnormalities in your sleep, don't hesitate to discuss the issues with your doctor. Sometimes, just a few simple changes in lifestyle or sleep habits can make a big difference in protecting your health and maintaining a long life. Sleep is not just about resting. It's about restoring the body and mind. And if you can improve the quality of your sleep, you'll notice a significant difference in your overall health and quality of life. Think of sleep as an essential part of self-care, an opportunity for the body to regenerate and recover. If you found these tips in the video helpful, don't forget to hit like, subscribe to the channel, and share it with your loved ones so they can also benefit from this valuable information. Leave your thoughts in the comments. Share what you've learned and let us know the changes you plan to make in your life. We would love to hear your feedback so we can continue providing useful content. Remember, your health is your most valuable asset. Don't let small signs go unnoticed without taking action. Thank you for watching, and we wish you good sleep and a healthy life ahead.